Hey, this is Shannon, and I know right now there's a lot of uncertainty and fear regarding COVID-19, the coronavirus. I'm here to tell you I've done the research. I took the time to come to understand this virus, from its origins to which countries are handling it well and which ones aren't, all the way to the United States and how the economy is doing, and most importantly, how to protect yourself and your family and what to expect next. You can check out this episode that I did on the Daily Turnup. Check it out on Spotify, iTunes, wherever you listen to podcasts. It's also on my Facebook and on YouTube. Give it a listen. Help educate and inform yourself and the ones you love so we can beat this virus and get back to our normal lives. This is the Daily Turnup, and I'm your host, M.R. Shannon. Today we'll be breaking from our normal format of 10 minutes and focus exclusively on COVID-19, the coronavirus. This episode will take a deep dive into the origins of the virus, how it spread to every corner of the world, which countries have responded well and contained the virus, like South Korea, and the countries who haven't, like Italy. Beyond that, I will break down how the virus spreads, what makes it so contagious, and how the U.S. is reacting. And most importantly, what's next and what you can do to keep you and your loved ones safe. First up, the origins of the coronavirus. There's a lot of discussion whether or not the virus is natural, as in it came from an animal and transmitted to humans, or if it was a bioweapon developed in China, more specifically Wuhan, or the United States, and the United States planted it in China. The theories of where the virus came from and its origins matter a lot for researchers as they work to develop a cure. So that's why we're going to dive down into the origins first because, start with the beginning. Senator Tom Cotton of Arkansas tweeted way back in January 30th, saying, "We still don't know where the coronavirus originated. Could have been a market, a farm, a food processing company. I would note that Wuhan has China's only biosafety level 4 super laboratory that works with the world's most deadly pathogens to include, yes, coronavirus." Then Steve Moschner wrote on February 22nd an opinion piece for the New York Post entitled, "Don't Buy China's Story, the Coronavirus May Have Leaked from a Lab." Moschner is not a biomedical scientist, but instead is the president of the Population Research Institute and author of a book called Bully of Asia, Why China's Dream is the New Threat to World Order. So that being said, it's fair to say he hasn't or wasn't or ever has been the biggest fan of China, and there could be a lot of partial bias in his claims to saying, why that the virus originated from China, that was a bioweapon that leaked from their laboratory. So, what evidence have Cotton and Moschner and others provided to support these suggestions or claims that this was a bioweapon that came from China? Well, as Cotton pointed out, there's a Biosafety Lab 4, which is a BSL-4 laboratory situated in Wuhan, China, the city where the whole outbreak started. Oh, and that lab had housed some other types of viruses among other pathogens. And it's not fair to simply claim that because there's a BSL-4 lab that the virus just got out. It doesn't work that way. It's not easy for a virus to escape a lab because the BSL-4 facilities maintain the highest level of security among biolaboratories, since they do work on dangerous and potential life-threatening agents such as Ebola, types of fevers, and Marburger virus. To be designated as a BSL-4, the lab has to have the appropriate ventilation systems, reinforced walls, security systems, and construction to keep the wrong things inside and the right things outside. And if your next thought is, well, okay, but why is it in Wuhan in the first place? Why isn't somewhere very remote for those, let's just play it, safe moments? Why is there a massive laboratory that has deadly viruses inside it, like in a city with a population of 11 million? Well, let's take a step back for a second. There are already at least 5 BSL-4 facilities in the United States. And if you weren't aware, some of those are near or in major United States cities. All right, so here are the 5 locations. You got Atlanta, Georgia, where the CDC headquarters is. You have Frederick, Maryland, Galveston, Texas, Hamilton, Montana, and San Antonio, Texas. And much like Wuhan, these labs have very bad pathogens that if got out would be very bad for the rest of the world. And because the United States has super intense labs, and among a lot of other things, China has blamed the United States for creating the virus and letting it loose in China. So it's like going back and forth right now, blaming China, blaming the US, and so on. Well, check this out. Zhao Lingjang, spokesperson and Deputy Director General of Information Department for the Foreign Industry of China, tweeted the following on the 12th and 13th of March. CDC Director Robert Redfield admitted some Americans who seemingly died from influenza were tested positive for the novel #coronavirus in their diagnosis after their death during the House Oversight Committee Wednesday. CDC was caught on the spot when did patient zero begin in US? How many people are infected? What are the names of the hospitals? It might be US Army who brought the epidemic to Wuhan. Be transparent. Make public your data. US owes us an explanation. His third tweet was an article link, and he said, "This article is very much important to each and every one of us. Please read and retweet. COVID-19, further evidence that the virus originated in the US." All right, so that's kind of like both sides of the story, where some people in the United States believe it was a bioweapon in China, and China believes it was a bioweapon in the United States and planted it in China. And at this point in time, there's no evidence to suggest the United States created the virus. No evidence how the US could get it to China and unload the virus there. It seems the Chinese government is shifting the blame around to get out of the spotlight and create a better public image for themselves. And after the Chinese claimed that the US or the US military created the virus, President Trump began to call the coronavirus the Chinese virus. It was controversial, changing the name like that, but the way it happened, how it developed is President Trump was asked about the use of the phrase when he started using coronavirus. And a reporter said, "Critics say that using the phrase creates a stigma." Trump replied, "No, I don't think so. I think saying that our military gave it to them creates a stigma." So that's kind of how President Trump has, dealt with the backlash by calling this the Chinese virus now. And he does that publicly for at least the last few days and will probably continue with that, so on. But okay, let's get back on track here. There is no evidence to say that this was a bioweapon used. There are no findings to say it was created in a lab. And besides, bioweapons kill at a much higher rate than what is happening now. And answer yourself this: why would one country unleash a bioweapon that would hurt the entire world? It just doesn't add up. So countries are blaming the other because of the challenging and uncertain times. And for the rest of the episode, we aren't going to be talking about this being a bioweapon. This is the only part we're going to be talking that's bioweapon. So let's focus now to the most likely origin of the virus: bats. Scientists saw that the virus closely resembled viruses that circulate in bats. If you look at the genetic sequence of the virus, it's closely related to bats, about 96% the same. That came from Jim LeDuc, head of the Galveston National Laboratory, a level 4 biosafety lab in Texas, when he was being interviewed by Vox. Chinese officials also repeated that several of the first clusters of cases had ties to a live animal market where both seafood and other wildlife was being sold. Those markets have since been closed. The market soon became the leading hypothesis for how the virus made the leap into humans, where it's been able to spread efficiently ever since. The genetic evidence and information, according to 3 esteemed infectious disease researchers writing in the New England Journal of Medicine, say implicates a bat origin virus infecting unidentified animal species sold in China's live animal markets. Okay, so here's the main point. This is what I want you guys to take out of this. Jim LeDuc agrees with the hypothesis that the animal market played a role in the virus jumping to humans from bats. He said the linkage back to the market is pretty realistic and consistent with what we saw with SARS. It's a perfectly plausible and logical explanation. The virus exists in nature, and jumping host finds that it like humans just fine. And so he's basically saying, yes, this is more than likely the case that it started with a bat, was able to jump through a human through these illegal, or it's legal in China, but it would be illegal in other places, wildlife, markets in unsanitary situations, and that's just how it happened. And one of the main reasons it's important to understand the origins is to make sure it doesn't happen again. Jim LeDuc continues, The reasons we're seeing coronavirus like SARS emerge in China is they have these live animal markets where they bring in animals alive and co-house them on cage on top of another, where there's an opportunity for transmission between a typical host. What we can take away from all this, it is highly unlikely a biological weapon was used and more like a transmission from bats. Of course, this isn't 100% facts, but it is very likely this is how the virus began. Regardless, the virus began in China and spread through China to infect other parts of the world. So, let's jump over to China, which is ground zero. All right, I'm going to throw in this massive disclaimer right now. According to top US officials and scientists, the numbers Chinese have reported are grossly underestimated and have been downplayed. But because we're not going to talk speculation or guesstimate numbers, I'll talk on the numbers given to the United States and major media outlets. And turnups. If you listen to the Daily Turnup, I've covered the virus almost every single day for the last 3 months. The virus began in Wuhan and spread throughout China, infecting thousands. The total number in China is around 81,000, recovered around 70,500, and deaths at 3,245. What this means right away are two things. First, there are about 7,000 to 8,000 infected citizens in China left, but they are reporting little to no new infections, which is a good thing, which is a really good thing because that gives hope that the virus can be contained and stopped. But before we get into that, what China did to curb the virus, let's dive into those numbers. A mistake people have taken when understanding how deadly the coronavirus COVID-19 is comparing the total deaths, which in China's case is around 3,245, and comparing it to the total number infected, which is 81,000. And that's just wrong, because it takes 2 weeks before symptoms arise in a person, but once they've been infected, they can start infecting others almost immediately, like give it a day or two. And once symptoms do show, the virus can last for 2 weeks before a person truly recovers, and if it's a really bad case, it can last anywhere from 3 to 6 weeks. So in order to get the true mortality rate, you can't compare those infected because you're looking at anywhere from a 4 to 8 week window about how long someone is, dealing with the virus. Therefore, you have to look at the total deceased and those that have recovered, which is, in China's case, 73,745 people. That is how many people were infected but are no longer infected. Out of that 73,745, 3,245 have died. Therefore, that is a 4.4% death rate, which is actually really pretty freaking high. And now, that's not to say it will get higher or lower because it all depends how the others, currently infected turn out. Like I said, there's 7,000 to 8,000 that are still currently infected. If all of them recover, that number is going to go lower. If they don't all recover, the number could stay the same or possibly get higher. The reason I did that numbers breakdown is because it's really important to understand how deadly the virus is and to understand how well South Korea handled the outbreak and how poorly Italy did. But before I jump into that, this is just a little preview, let's finish with China. Not only is China important because it was ground zero, but because they have almost no new cases now. World Health Organization's Dr. Bruce Aylward, who led the international team of 25 health experts, said hundreds of thousands of people in China did not get COVID-19 because of the aggressive response, adding that the techniques were old-fashioned public health tools but applied with a rigor and innovative approach on a scale that we've never seen in history. At the same time, professors, journalists, and doctors in China have been silenced and disappeared after they shared vital information about the coronavirus outbreak without the consent of the Chinese government. According to Dr. Aylward and his research in China, the following were the key ways to stop the spread of the virus. Trains and public transportation stopped in Wuhan. With a population of 11 million, cutting off all public transportation stopped movement for millions of people, which was the goal. People who thought they had the novel coronavirus in China would often be sent to a special fever clinic, which have been widespread since the country dealt with an aggressive SARS outbreak in 2002. Their temperature would be taken and they discussed their symptoms, medical history, travel history, and any prior contact with anyone infected with a doctor. If necessary, patients might receive a CT scan, which is one way to do an initial screening of COVID-19. Also, they made the coronavirus testing easily accessible and free, and China built new hospitals and in a rush, with workers working overnight, day and night to get this done. China built 2 new 1,000 and 1,300 bed hospitals to fight the coronavirus. One was actually created in 6 days, and the second in 15 days using like prefabricated module house things that they were able to work together. They would convert a training center or a stadium in between 24 to 72 hours. Al Word continued to say that was a time frame they took in Wuhan to increase by 1,000 their capacity. So China made it their number one goal to create more bedding and hospitals, to hold anyone that was infected. And China walled off entire hospital wards to contain the virus. So the country postponed non-urgent medical care and moved many doctor visits online. Not all patients were given the critical care they needed during the outbreak, though, and it's obviously not good. But the hospitals became like strict coronavirus hospitals, so they didn't mix with other sick patients at the hospital, to possibly contaminate them and spread the virus there. China also issued the highest level of quarantine in modern history. At one point, 60 million people were quarantined and couldn't leave their homes. If sick and caught in the streets, Chinese authorities took care of the issue. China, in the end, relied on a few key factors to get rid of the virus. First, like I just mentioned, the most intense self-isolated quarantine in modern history, restricting people to their homes in order to keep the virus from spreading. Second, they quickly built hospitals in order to combat the growing numbers of infections. And finally, the Chinese government spent a lot of money and all their focus to stopping the spread. The issue now for China is the virus making a comeback. With the rest of the world infected, it is likely a comeback is probable. And like I said before, I started focusing on China. These numbers may not be accurate. Remember, China is a communist country that has massive control over its people and what they hear and what they do. It could be a lot worse, but their voices cannot reach through that great Chinese firewall. Also, before we move on, I feel it is important to share the following, but I don't have those primary source evidence to back what I'm about to say. China withheld information about the severity of the virus in order to protect their economy and not get the wrath of the rest of the world. There are reports of doctors, media agencies, and other ordinary people speaking out that have disappeared or are dead because of the virus. There are some reports of burning bodies and detaining anyone who leaves the quarantine of their home. China took extreme action in order to contain the virus, much of which can be seen as a horrific abuse of human rights and eliminating internal threats. All right, with that piece said, let's jump to the second of 3 countries we're going to talk about, South Korea. And I won't talk too long on South Korea, but the numbers they report are very accurate, and actions they have taken has drastically reduced the virus and should be the model for the rest of the world to follow. South Korea has emerged as a sign of hope and a model to emulate. The country of 50 million appears to have greatly slowed its epidemic. It reported only 74 new cases on 16 March, down from 909 at its peak on the 29th of February. And it has done so without locking down entire cities or taking some of the authoritarian measures that China, took while it was trying to get its country under control. South Korea is a democratic republic. We feel a lockdown is not a reasonable choice, says Kim Woo-jo, an infectious disease specialist at the Korean University. South Korea's success may hold lessons for other countries, and also a warning. Even after driving case numbers down, the country is braced for another resurgence. Behind its success so far has been the most expansive and well-organized testing program in the world, combined with extensive efforts to isolate infected people and trace and quarantine their contacts. South Korea has tested more than 270,000 people, which amounts to more than 5,200 tests per million inhabitants, more than any other country except tiny Bahrain, according to Worldometer website. The United States has so far carried out 74 tests per 1 million inhabitants. Data from the U.S. Center for Disease Control and Prevention's show. All right, you may be asking yourself right now, How was South Korea so prepared? How were they able to test so many people so quickly? Like 5,000 more people a day than the United States is, or per million than the United States is. Well, South Korea learned the importance of preparation the hard way. In 2015, a South Korean businessman came down with the Middle East respiratory syndrome, MERS, after returning from a visit to 3 Middle Eastern countries. He was treated at 3 South Korean health facilities before he was diagnosed with MERS and was isolated. By then, he set off a chain of transmissions that affected 186 and killed 36, including many patients hospitalized for other ailments, visitors, and hospital staff. Tracing, testing, and quarantining nearly 17,000 people was able to squash the outbreak after 2 months. The specter of a runaway epidemic alarmed the nation and dented the economy. That experience showed that laboratory testing is essential to controlling an emerging infectious disease, Kim says. In addition, he says, the MERS experience certainly helped us to improve hospital infectious prevention and control. So far, there are no reports of infections of COVID-19 among South Korean healthcare workers. And if you haven't picked up already, South Korea is all about data collecting. That's what they did in 2015 to prepare for right now, and that's what they're continuing to do right now to prepare for the next epidemic. The national testing capacity has reached a staggering 15,000 tests per day. There are 43 drive-through testing stations nationwide, a concept now copied in the United States, China, and the United Kingdom. In the first week of March, the Ministry of the Interior also rolled out a smartphone app that can track the quarantine and collect data on the symptoms. Kim says medical doctors are also planning to share details of the clinic features of COVID-19 cases in the country in forthcoming publications. We hope our experience will help other countries control the COVID-19 outbreak. Most of the information I shared with you regarding South Korea was conducted in a report by Dennis Normile. Okay, let's look at the numbers because at the end of the day, that's what matters. Knowing how many people have died and how many have been infected. South Korea has a total of 8,500 cases. Yes, a lot less than China does. And of those cases, there are 91 deaths and 1,947 have recovered. Remember, this virus can take anywhere from 4 to 8 weeks, so it's a very long time. And just like China, let's look at closed cases to get an accurate reading of how deadly the virus is. Closed cases are those that have recovered and deaths, and that number combined, the ones that are no longer infected, that's what closed case means. So there are 2,038 closed cases, and with that, 91 deaths, which equals a 4.4 death rate, virtually the same as China. The difference is the small number of people infected. This is because Korea is testing everyone and anything and quickly isolating those infected and containing the spread without locking down cities. Again, if you test positive, Korea will send you to isolation, then ask you a number of questions and find out everyone you have been in contact with, and then they're going to go test those people. What that does is it identifies everyone who has it and stops the spread, which is why they have such few cases. Also, Korea has a very low population of 6-year-olds or older, which is at 18.5% of their population, which ranks 53rd in the world. And if you're not aware so far, older people, those with predisposed medical conditions, are more likely to be infected and not make it if they do become infected. And now our last country, Italy, who has arguably been the hardest hit country in the world. Italy is in its second week of nationwide emergency measures that severely restrict domestic travel and ban public gatherings, a blanket decrease intended to slow the spread of the coronavirus pandemic there. Italy is the epicenter of the outbreak in Europe, with more than 31,000 COVID-19 cases as of March 18 and more than 2,500 deaths. Italy's measures are in place until at least April 3rd. For now, Italians are following the rules, and the rules have radically transformed life. Stores limit the number of people who shop inside at one time, so people wait in line, putting 1 meter of distance between each person. An entire nation has abandoned its expressive gathering or its expressive greetings because in Italian culture, hugging, kissing, handshakes, it's very important. So they've had to, do away with that and really change their culture. In southern Italy, the outbreak is not as intense. Remember, it started in northern Italy, in Lombardy district. To help you with geography there, it's in Milan, or the district that Milan is in. And so, yes, southern Italy hasn't been hit as hard. But doctors like Di Franco worry the coronavirus will arrive with force there too, because thousands of people tried to flee from the north to the south once the restrictions of the north were introduced. They were either, going back to return to their homes or skirt the initial lockdown, because that's just not fun. Thus, putting all of Italy under the same rules equalized everything and brought the country together for a common purpose. Economic anxieties also hang over the lockdown, and that's something we're going to dive into really hard for the United States. But in Lombardy, again, that's that county, that area of Italy where the outbreak really broke out, accounts for about 20% of Italy's economy. Milan is an international business headquarters with factories and businesses that rely on the global supply chain. Italy's economy had already been one of the more sluggishes in Europe, and these disruptions are threatening even more permanent damage to the country. So, when you look at Italy, it's very different from South Korea for a few reasons. First, South Korea conducted 3,692 tests per million people compared to Italy's 826 tests per million. And that's the key for South Korea, why it's been able to, have such a few amount of people infected. Also being so close to China is because they're testing everyone and being so proactive about that. Then there's the population. According to a UN report in 2015, 28.6% of the Italian population was 60 years old or older, second in the world after Japan at 33%. The impact of this disparity is quickly shown in the analysis of coronavirus deaths in each country. In Italy, 90% of the more than 1,000 deaths have occurred in those 70 or older. Smoking is another factor clearly associated with poor survival skills when it comes to respiratory illnesses. Italy's coronavirus cases is occurring among the old and the very old, and them were smokers. Italy also wasn't as prepared for something like this and didn't have the infrastructure or resources in place to react quickly and effectively like South Korea. Okay, what I'm about to say is a lot and is the most extreme but also the most terrifying bit of information I will give you for this episode. Italy's breakdown by the numbers. We've done it for China and South Korea, and their big takeaway was a 4.4% death rate, which isn't good. And just say Italy is a lot worse. Italy has 35,713 coronavirus cases and almost 3,000 deaths, and 4,025 have recovered. So when you look at closed cases, meaning everyone that was once infected and no longer are, that is a total of 7,003. As I just said above, there's 2,978 that have died and 4,025 have recovered. That is a death rate of 42.5%. And that number is just horrifically high. Think of it this way. A little less than half the population who gets the virus, compared to South Korea and China, which is around 4%, almost half the population that gets it dies. That is crazy. Okay, turnips. The second half of this episode is going to focus on the United States, what the virus looks like, what the United States is doing, how the economy is doing, what the president is doing, and what you can do to stay safe and keep your loved ones safe. But first, if this is your first time listening to the Daily Turnup, make sure you follow us and give us 5 stars and tell everyone you know to give this episode a listen and share the knowledge, because knowledge will save lives. And if you're watching this on Facebook or YouTube, go to Spotify, iTunes, or wherever you listen to podcasts and follow the Daily Turnup. Thank you, everyone. All right, the second half, the United States of America. In a matter of days, millions of Americans have seen their lives upended by measures to curb the spread of the new coronavirus. Parents juggle childcare as schools close, perhaps for the rest of the school year, and restaurants and bars sit empty as more and more convert to delivery-only options. Question you may be asking, how long will this last? On Monday, President Donald Trump said the U.S. may be managing the outbreak through July or August. And New York Governor Andrew said that the state's numbers of the coronavirus cases may peak, not end, in 45 days. The overall message is that the country will be fighting the virus outbreak for a matter of months at least, not days or weeks. From looking at South Korea, the name of the game is slowing and stopping the spread of the virus, and that begins with first identifying who is currently infected, then putting measures in place to slow it down. Elizabeth Halloran, a disease researcher at the University of Washington, said, basically, if I infect one other person or more, then the epidemic will take off. If I infect less than one person and everybody infects less than one person, then the epidemic will decline. And based on data from China and from cruise ships, scientists estimate that unless measures are taken to limit the spread, each infected person will infect between 2 or 3 others, leading to an exponential growth of the virus. If the virus makes a jump to a new person every 2 to 5 days, as scientists have calculated, then a single infected person could lead to 4,142 total infections within a month, assuming nothing is done to break chains of transmission. And how you get that number in just a month is because if I infect 3 people and those 3 people infect another 3 people, and yes, just continue doing the math there. And Jeffrey Shannon, a public health expert at Columbia University, said unless such measures are put in place, scientists estimate that between 40 and 80% of the global population could become infected. Based on analysis of data from China, scientists found that the majority of new infections are transmitted by people with mild symptoms who may not even know they're ill at all. And in order to slow the spread, you have to limit contact between people. Schools have closed, more restaurants, bars, and have closed, and being in groups of 10 or more is not allowed. Sporting events are canceled, and there's a lot more too. But here are a few things pushed out by President Trump and the government. If someone in your house is tested positive, keep the entire household at home. Do not go to work or school. If you're an older person, stay home and away from others. If you have a serious underlying health condition, stay home and away from others. Avoid travel, shopping trips, and social visits. Avoid eating or drinking in restaurants, bars, and food courts if they're still open. Use drive-through only pickup and delivery options. And do not visit nursing homes or retirement homes or long-term care facilities unless you are there to provide critical assistance. Remember, the elderly are the most at risk of this virus. And finally, practice good hygiene, such as washing your hands, especially after touching frequently used items or surfaces, and please avoid touching your face. As the virus continues to spread and get worse before it gets better, leading experts say a vaccine is the only way to officially put an end to the virus and have our lives get back to normal. But a new report has come out, and it's really interesting because a vaccine, according to experts, is 12 to 18 months out. But what may be more feasible is a plan for intermittent restrictions and enhanced monitoring to control the disease, an idea explored in a new study from researchers at the Imperial College of London. Once the number of new cases falls below a certain threshold, schools, offices, and restaurants could reopen. But if that number of infections spike again, restrictions would be reinstalled. The analogy of pumping car brakes on an icy road is what you should be thinking about. Michael Levy of University of Pennsylvania Disease Research said, "You push on the brakes to slow things down, then ease up. But if you skid, you have to pump the brakes again." And this makes sense. Once the United States has a handle on this, restrictions should be lifted, and when cases arise in certain areas of the country, then those areas should shut down. Honestly, it'll be really interesting to see how the country establishes a new normal until there is a vaccine. But that talk is for a different episode. When we look at everything I just said, schools closing, travel being restricted, restaurants and bars shutting down, and other businesses closing temporarily to handle all this, the U.S. economy is suffering and suffering a lot. Just look at the stock market. It is tanking, and with people temporarily being laid off and paychecks aren't coming in, money will be scarce. And what the heck is everyone going to do once the paychecks stop coming in? Well, President Trump, led by the Secretary of Treasury, Steve Mnuchin, among both Congress and the Senate, have made this priority 1 or 2. And of course, 1 would be defeating the virus, but it's right there with keeping the economy going. But of course, the virus is number 1. Okay, let's dive into the economy and how ordinary people like you and me are going to manage the financial ensuing chaos. First off, there's a lot of different stimulus packages that are being worked on in order to keep the economy in the heart of America alive and beating well. The White House is seeking a stimulus package worth between $850 billion and $1 trillion that could result in the emergency funds for individuals and assistance for small businesses and credit for industries hard hit by the reaction to the virus. Treasury Secretary Steve Mnuchin said that the administration's plan could put cash directly in the pockets of Americans, and administrative sources told CNBC there could be $500 billion to $550 billion in direct payments or tax cuts, $200 billion to $300 billion in small business assistance, and $50 to $100 billion in airline and industrial relief. Congress will have to approve the proposed stimulus package. The Fed has already cut interest rates to zero, boosted liquidity in the repo market, and launched a new $700 billion quantitative easing program. Also, there are talks about suspending mortgage payments for 2 months. As this story develops, we will cover that. And it's increasingly likely that Americans will get a government check of $1,000 or more in the coming weeks, which is part of that $1 trillion stimulus bill we just talked about. And those negotiations between Congress and the White House are fluid, and it could even be 2 $1,000 checks if the virus continues. And if you're thinking, wow, that's crazy, the government is going to give me, money to handle this, well, this isn't the first time. In 2008, Americans received a check for $300 to $600 from the federal government, plus $300 per child under the age of 17, just before the financial crisis as a part of a massive stimulus bill. And in 2001, the government also cut a $300 check to most Americans. A survey revealed Tuesday from NPR and PBS and Marist found that 18% of Americans workers either lost their job or had hours cut from work schedules. It is only expected to get worse, but it has fueled calls for the government to step in with direct emergency aid. Economics such as Jason Forum, the head of the Obama administration Council of Economic Advisors, backed the idea of sending checks to people earlier this month. Yes, those checks that we're talking about, it is backed by both Democrats and Republicans, and that's great that we're coming together as Americans. And the proposal has gained more speed, like Senator Mitt Romney is behind it, and the Trump administration is actually weighing even larger checks to encourage spending and helping people make ends meet. So again, we're looking at maybe a $1,000 check, maybe 2 $1,000 checks, and Trump is even suggesting more money than that. And to wrap this part up, Treasury Secretary Steve Mnuchin said the administration is aiming to send those first rounds of checks by the end of April. Some reports even saying April 6th. And those are the initial steps to stave off a Great Recession or Depression. The airline industry will need a $50 billion bailout. The hotel industry will need a bailout. Any transportation company industry will need a bailout. The majority of small businesses will need a bailout. But unfortunately and inevitably, they all won't get the money. And those are just a few. Think of all the retail stores that won't have shoppers, or manufacturing that builds parts or for planes, or construction companies, and the list goes on. Before we round this out with what you can do to keep your family and friends safe and what we can expect over the next few weeks and months, I'm going to take a quick look at President Trump. It's important to look at the president because his actions will determine what happens in America. Just like how President Obama steered America from the Great Recession and bailed out the vehicle industry and set the economy back on track. In times like this, the president is more important than at any other time in the presidency. And of course, Congress and the Senate matter, but it is the president who the vast majority of Americans will look to for guidance and hope. President Trump has described himself as a wartime president, fighting an invisible enemy, and on Wednesday invoked rarely used emergency powers to marshal critical medical supplies against the coronavirus pandemic. Trump also signed an aid package with the Senate approved earlier Wednesday, and that will guarantee sick leave to workers who fall ill. Trump tapped his authority under the 70-year-old Defense Production Act to give the government more power to steer the production by private companies and try to overcome shortages in masks, ventilators, and other supplies. Trump said he will expand the nation's diagnostic testing capacity and deploy a Navy hospital ship to New York City, which is rapidly becoming an epicenter of the pandemic, and will send another ship to the West Coast. And the Housing and Urban Development Department will suspend foreclosures and evictions through April to help the growing number of Americans who face losing jobs and missing rent and mortgage payments. The Senate overwhelmingly passed a second coronavirus response bill, which Trump signed Wednesday night. That vote was a lopsided 90-8, despite worries by many Republicans about a temporary new employer mandate to provide sick leave to workers who get COVID-19. The measure is also aimed at making tests for the virus free. The White House urged hospitals to cancel all elective surgeries to reduce the risk of being overwhelmed by cases. Trump linked the efforts to the measures taken during World War II and said it would require national sacrifice. It's a war, he said. I view it as in a sense, a wartime president. It is a very tough situation. All right, let's break down America by the numbers. I want to say that testing in America has been very low, and there could be more people infected than identified. And as testing increases, there could be a massive jump later next week simply because testing is more readily available, not because the virus has gotten substantially worse in the country. And as of March 19th, 2020, the United States has 9,464 coronavirus cases, 155 deaths, and 108 recoveries. Right away, this can be seen as absolutely terrifying because of the closed cases being 263. Again, closed cases come from the number of people that are no longer infected because they either died or fully recovered, thus meaning the United States has a mortality rate of 59%. Yes, over half the people that become infected die. But before you let that number really digest, understand those first infected in the United States were the elderly homes, and thus the elderly who are the most vulnerable to the virus. Yes, the percentage is super high, but it targeted the people who aren't prepared to handle a virus of this nature. Anyways, this is still terrible, this isn't good, and that number is very high. With that being said, and let's talk about what we can all do to stop the spread of the virus. First, you need to know if you have it. Fever, cough, and shortness of breath usually show in about 2 to 14 days. The key there is 14 days because that's how long the virus can be dormant, and during that time you can still spread the virus without even knowing you have it, which is by far one of the most scariest parts about this entire virus. Therefore, everyone needs to get tested because anyone can be a carrier. In order to stop the spread, you should conduct social distancing and be serious about it by keeping 6 feet away. Stop touching your face. COVID-19 is mostly spread from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It is also possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. So, when you go in public, don't touch your face. That's the biggest thing. Just do not touch your face. Use disinfected wipes before and after entering a store and stay away from people. Use that 6-foot rule. It's there for a reason. Clean your phone. We touch our phones more than anything else, and it is as dirty as your hands. So if you wash your hands and you don't clean your phone, well, check it out. You didn't really wash your hands then, now did you? The other major issue is if you become a carrier. First off, you may have no idea if you're a carrier. You may have no idea if you're sick. And second, if you choose to interact with people, you're not only potentially spreading the virus, but you can put the person's life at risk. If you interact with anyone over 60 and you had the virus or have the virus, you can potentially give them the virus. And according to statistics we broke down a little earlier, they don't have a high chance of survival. So if you work in the health field at all, you guys are probably the most spun up on this, but obviously you have to be so careful, and you have to take all of this extremely seriously. This is why we have to take the virus seriously, and America has to show the world how to act in order to stop the spread of the virus. Americans, turn-ups, those that are listening, check this out. Only America can stop the spread. We all have to do our part. The United States has been the leader of the world since World War II. We must choose now to lead the world in how to react to this virus. We must show them how to react, how to do the right thing when no one is looking, how to take this virus seriously and not take it as a joke. Not just talk about it on memes, but show through action that the United States of America will lead in the fight, in the war against the coronavirus. That we will show we will not panic, that we are not fearful, that we will help our neighbors. If you have sick neighbors, if you have elderly neighbors, you know what? Do the right thing. Go shopping for them, be very safe, and leave food for them on their doorstep. Because if America can do the right thing, if America can stop the spread of the virus, the rest of the world is watching, and they're watching us, and they will do as we do, as they have for decades and decades. Americans, people, turnips, those that are listening, do the right thing. Don't go out in social gatherings. Wash your hands. Use disinfectant on the things you have. Don't spread the virus, and make sure you get tested. Finally, what's next? The virus isn't going anywhere, so get used to what's going on to be the new normal, at least for a few weeks, possibly months, maybe a little more. There's still uncertainty out there, and the virus is scary. The economy is hurting, and the stock market tanks every day. But there's nothing fundamentally wrong with the market or the United States economy, so everything is going to recover. The stock market will increase, transportation and travel will happen again, and going to restaurants and bars will be a thing. Remember, all of this is temporary, and nothing has to be scary. We don't have to let fear ruin our days, because if we do the right thing, then things will be okay. The world's number one priority is stopping the virus. And if you have no faith in the world, then look around. The world has put people on the moon, created spaceships, planes, cars, and a cell phone that can tell you literally almost anything. And the world has created spectacular structures. It is a matter of when, not if, there will be a vaccine to the virus. Until then, wash your hands. Avoid people by conducting social distancing. Support others the best you can, and get tested as soon as you can. For the first time in our lives, we, the people, control what happens next. The government will do everything they can to keep the economy going and fight even harder to find a vaccine. But until then, it is on us to limit the spread, to take it seriously and believe in the process and not give in to panic and fear. We got this. If this is your first time listening to the Daily Turnup, I hope you enjoyed the show. We will be back to our normal 10-minute format of breaking down what's going on in the world today and helping you digest all. If you liked the episode and you want to stay up to date, make sure you follow the Daily Turnup, give us 5 stars, and tell your family and friends about the podcast. Also, follow us on Instagram at the Daily Turnup. We post updates throughout the day and as stories develop and help you understand what's going on. Thank you for your time. I'll see you tomorrow.